Hello, Holistretch fam. Welcome to this video. My name is Frances Eve, and today I'll be showing you a quick tutorial on how to release your client's head, neck, and shoulders. Please subscribe to the channel if you haven't yet done so, and let's begin. Let's begin by moisturizing the hands with a little bit of massage cream, oil, or lotion. I recommend Biotone massage cream. It's not greasy, not oily, and glides easily. We're going to go ahead and rest our knees down on the floor. I use the head cradle of my massage table to press my knees into for extra cushion. If you don't have that, you can use a pillow. We'll bring our hands to the top of our client's shoulders, and we're going to push the left and then the right down, downwards along their spine, down towards their hips. Using our hips as guidance for our shoulders, we'll slowly press down the left side and then the right side. Each time you press down, you can glide the hand over towards the head and notice if they have more tension in the occiput, the levator scapula, or the trap. And just listen and just notice. We'll start with our first resistance stretch by cradling the head in the left hand, bringing the palm of the hand to the back of the head. We'll take your right hand and have your client squeeze the shoulder up to the ear and slowly release it down along the spine. Notice already from the first stretch how much more space there is between the ear and the shoulder. We'll tend to do between 4 and 6, depending on how relaxed your client wants to be versus if they're ready to stretch. If they're ready to stretch, do around 5. If they just want to relax in a massage, then I only do around 2. Feeling into their neck and their head, and feeling the tension release as they resist the stretch. Now with this new space here, we can palpate in the levator scapula, and we can bring our thumb to squeeze the traps gently, and being mindful of the location of your thumb. So really trying to keep your thumb in line with your wrist, in line with your elbow, in line with your shoulder. Keeping that alignment in your arm is so vital and important so that you don't have burnout and you don't burn your thumbs out. And we can press into the occiput. We can tilt their head over towards the left by using our left hand to guide. And gently using our body weight from our shoulder to press down into these tight spots. We'll go into our second resistance stretch by having them press their right ear down towards their right shoulder, and then pulling the head over to the left. Now be mindful of the angle. In this instance, it's important to be very communicative about the direction and the angle on which they have their head, so you don't pull anything or have them do anything awkward. You want to create a nice angle. Wherever you feel the tension in their neck, you want to open it up by having them squeeze their right ear down and pulling the head gently to the left. I like to bring the left hand underneath as it creates a deeper cradle and also compression in the occiput. So you can actually gently pull with the forearm to pull the head open and stretch out the neck. Sliding the thumb down here, we have access now to the scalenes. And then before we move on to the other side, we can give their occiput a bit of a rub down. So this feels so good on the bottom of the head, the scalp. We can use a little bit of our fingertips and our nails as well in here and scratch the back of the head, making big circles. You can use a little bit of pressure in the fingers to release and relax the back of the head here. Have them open up the back of their neck by pressing the back of their head down into your hands and then push the head back up. Do so gradually, softly, and really listen to their bodies so that you don't over push their neck. And then after this stretch, and you're welcome to do more reps as well, you can feel into the back of their head and feel the opening. When we work with the head and neck, it is really vital to listen to the body because the neck is so tender, it's fragile, and it also carries so much stress and so much tension. Let's go ahead and move on to the other side. We'll start again by bringing our hands to the tops of the shoulders and pushing them down along our client's spine. We can lead with our hips in order not to strain our own arms. And that allows us to use more of our body weight as well. I like to use the space between my thumb and my knuckles to squeeze the traps, to release tension along the shoulders. Sometimes the traps need to be released even before we can move the shoulders. Gentle squeezies are good in here. You can always ask your client to make sure you're not squeezing too hard or too little. See what kind of pressure they like. Next, we'll go into the resistance stretch, squeezing the left shoulder up to ear and then pushing down. We do between 4 and 6 reps. But again, if you want them to just relax and enjoy, then just a couple times is sufficient. After the resistance stretch, always feel to see the difference, the shift, the change, the opening, the space. And you'll notice the more that we work, the softer the tissue becomes. That's what we want. You also might notice that their head begins to move around a little easier. It's a little less stiff. Their head might get a little bit more heavy as they begin to relax. And we'll go into our second stretch, pressing the left ear down to left shoulder this time. And if you like, you can cradle their head with the right hand to use as leverage. For this one, it depends. If my client's very, very strong, then I will need to use my other hand as leverage to push the shoulder down. But if they're not so strong, then I don't need to do that. So just gauge to see if you need that hand there or not. And then you can use your forearm to create a little pressure along the occiput, the back of the head. And then for decompression here. You can also use the knuckles if your thumbs are sensitive or your fingers are sensitive. Because my client felt so tight and tense in the head and neck, it was a little challenging for him to relax, but there were some moments where his whole body relaxed and he was able to be still, which is really the golden moment when you can work on someone's head and neck and they become still, if only for a few moments. That stillness can really change their entire day, week, month. We'll go ahead and work the back of the head, have them press the back of the head into your hands and then gently push up. Creating resistance in the back of the head. Now we're noticing a little more movement here. And then we'll go into the back of the head rub, the occiput rub. You can use more or less pressure, really depending on the density of your client's tissue. So with this client here, his tissue is very, very dense, so I was able to use a lot more pressure. Whereas if I had someone with lighter or more fragile tissue, I would certainly use far less pressure. So always gauge and listen to what your client needs. And if you're not sure, just ask. To stretch out the neck, I like to bring the right hand to the left side, pull over to the right, and vice versa. And then we can use a decompression practice by bringing a sheet towel or the head cradle cover to behind their neck, and then we'll lift up by pulling the head just slightly up and back. We can go to the diagonal, to slightly right and slightly left as we pull back. This may take a little bit of practice, but really you're going to notice in how you feel. You will feel a decompression in their neck. Very good. We can end with some palpations on the chest, the pecs, to release the pecs. And then I like to have my clients grab onto my wrists as we open up their arms and shoulders and chests one last time. Thank you so much for joining me in this video. My wish to you is that you feel free and everyone you work on feels free as well. Have a beautiful day, and I'll see you in the next video.